Very good evening to all. Welcome back to Vichita Rajkumar YouTube channel. In this video, I am going to discuss about the spinal cord. So this is the topic is allotted for the day 2 challenge for the BS nursing first year first sem examinations who are going to write the examinations in the month of June 5th to 7th, especially in Telangana state. So already I have given plan for 21 days challenge. So this is the topic is allotted for the day 2 challenge. Okay, so day 2 challenges three topics will be there. So morning I have done the video. So that is like a structure of the brain I have completed. So this is the second topic in day 2 day 2 challenge. So this is a spinal cord and one more topic also there, that is the cranial nerves. Okay, later I will give the that topic also. So now I am going to Okay, so now I'm going to show the content about the day 2 challenge. Second topic is the spinal cord. The spinal cord is a long, thin, tubular structure made up of the nervous tissue, which extends from the medulla oblongata in the brainstem to the lumbar region of the vertebral column. So this topic is very very important for you people. So that is the reason you have to know. Okay, so already the CNS, PNS, ANS. So this is a very very important topic in the nervous system. It may be anatomy or it may be physiology also. So physiology is nothing but the functioning of the organs in our body system. Anatomy is nothing but the like structural. Okay, anatomical locations, parts, and everything it will deals with. Okay, so here the anatomy of the spinal cord is, it is a long. Okay, so it is a like they will be there. Okay, the spinal cord is a long, and it is also not only long, it is a long, thin and tubular structure. Okay, the spinal cord is a long, very thin and tubular structure made up of the nervous tissue. Okay, not only thin, tubular, long structure, it is also made up of the tubular nervous tissue which extends. So it is extends from the extends from the middle oblongata in the brain stem to the lumbar region of the vertebral column. So this is a very very important like introduction you have to write. Okay, long, thin, tubular structure made up of the nervous tissue and extends from the middle oblongata in the brain stem to the lumbar region of the vertebral column. Okay, so this is nothing but the spinal cord. If you see, the spinal cord is located in the vertebral foramen and is made up of the 31 segments, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. So this is, you have to keep it in mind. So this is the long, this is a long, so this is a, okay, this is a long thin tubular structure is the, it is mainly located in the vertebral foramen. It is a where it will be located, the spinal cord is mainly located in the vertebral foramen and made up of 31 segments. It is a made up of 31 segments. In 31 segments also 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. So this overall 31 segments. It's a, the spinal cord is mainly made up of the 31 segments. That is 31 segments. It is divided into like 8 cervical, 12 thoracic, 5 lumbar, okay, 5 sacral, 1 coccygeal. Okay, this is like if you see the, so this is a cervical, so this is a thoracic, this is the lumbar, this is a sacral, last one is a coccygeal. Okay, so here the posterior median sulcus cross sectional view of the spinal cord. If you cut, so the main structure of the view of when we'll cut the spinal cord, there is a cross sectional view of the spinal cord looks like this. Okay, like a butterfly structure will be there. Okay, next coming to the functions if you study, it may be useful for the even you're writing the physiology also. The major roles are relay, it will relay the messages from the brain to different parts of the body to perform an action, to pass along messages from the sensory receptors to the brain and coordinate reflexes that are managed by the spinal cord alone. If you want to write, you can write in the physiology content also. Okay, so this is the structure of the spinal cord. If you cross section, if you see the cross sectional view of the spinal cord. Okay, so this is the like a, if you see the spinal cord level, here they have given level and motor function of the levels. Okay, already have, if you'll keep in like a CT, CTLSC, that you have to keep it in mind ma. CTLSC, CTLSC, CTLSC. C means cervical, T for thoracic, L for the lumbar, S for the, okay, sacral, C for the coccygeal. Okay, cervical, thoracic, lumbar, sacral, coccygeal. Okay, CT, CTLSC. Okay, C for the cervical. If you'll see this is the structure of the spinal cord. Okay, brain, spinal cord. Okay, so here up to, okay, see here. If you'll see the cervical, in cervical, C1, C2, C3, C4, C5, C6, 7, 8, up to 8 cervical. Okay, see how many are there? 31 segments will be there. No, the spinal cord is made up of the 31 segments. In 31 segments, 8 cervical. You got it now? So these are the 8 cervical segments. Next, coming to the T1, T through T4 up to 12 will be there. Thoracic 12. Okay, cervical 8. Thoracic, how many are there? The 12 is there. Okay, T1. 1, 2 will be there. No, this is the, okay, like it. Next coming to the lumbar. Lumbar how many is there? Lumbar L1, L2, L3, L4, L5. Okay, 5. Next sacral S1, S2, S3, S4, S5. 5. Coccygeal is a tail-like structure. This is the coccygeal 12, 31 segments. Okay, if you want you can go through this one. Level C1 to C6. Neck flexures will be there. The motor function. The cervical C1 to C6. Next C1 to T1. Neck extensors. Next is C3, C4, C5. Supply diaphragm. Okay. And C5, C6, it's a move shoulder, raise arm, deltoid, flex elbow, biceps. Okay. 6, that is the main function. The C6 is the extend, rotate, supinate the arm. Next C6, C7 function, extend elbow and wrist, triceps and wrist extensions and pronate wrist, flex wrist, supply muscles of the head. Okay. This is. Okay, T1, T6, there's a functions of the okay segments. You got it? Okay. If you want, you can write one more points also. The situation extends. The spinal cord lies loosely in the vertebral column, extends from the foramen magnum, where it is continuously with the middle oblongata. Shape and length. The spinal cord is cylindrical in shape. Length of the spinal cord is about 45 centimeters. This you have to keep it in mind, ma. So what is the shape of the spinal cord? Cylindrical shape. That you have to make it in notes. The spinal cord is cylindrical in shape. The length is the 45 centimeters in males. Females 43 centimeters. It is average diameter of the 1.25 centimeters. Okay, covering. The spinal cord is covered by the shades called meninges. Okay, the spinal cord is covered by, this is also important point. Shape, size, weight, everything you have to know it. Okay, the spinal cord is covered by the shades called meninges, which are membranous in nature. Meninges are dura mater. Okay, the meninges against having some partitions like a outer layer, inner layer, middle layer, dura mater, pia mater, arachnoid matter. So these are the covering layers of the meninges parts. Okay, next these coverings continue as coverings the brain. Okay, so meninges are responsible for the protection and nourishment of the nervous tissue. So these are the very very important content for you people. Okay, so this is you have draw it ma, spinal cord, cervical. I told no, C T C T L S C. CTLSC, CTLSC, cervical, thoracic, lumbar, sacral, coccygeal. Okay, this is you have to keep it in mind from starting encephalon to phylum terminate. Segments like the vertebral column, the spinal cord is also segmented through the segments are not visible externally. The parts of the spinal cord to which a pair of spinal nerves, right and left, it is attached to known as spinal segment. Okay, so this is cervical, neck, thoracic, chest, lumbar, abdomen, sacral, pelvic, coccygeal, tailbone. This you have to keep it in mind. So these are also very very important one. So cervical, where it is located? The cervical, it is located in the neck region. Thoracic, where it will be located? Chest region. Lumbar, abdomen, sacral, pelvic, coccygeal, tailbone. So coccygeal, one more name is a tailbone. Okay, this is. Next coming to the spinal cord. Internal structure of the spinal cord. The cross section of the spinal cord shows that it consists of an inner core of grey matter and a peripheral zone of white matter. In cross section of the cord, the grey matter is seen as H-shaped. The cross section of the cord, spinal cord, the grey matter is seen as S-shaped or butterfly shaped fluted column extending throughout the length of the spinal cord. It is divided into symmetrical right and left comma-shaped masses which are connected across the midline of the transverse gray commissure. The central canal of the cord passes through the center of the gray commissure. The canal is surrounded by the substantia clytonis centralis. The lateral comma-shaped mass of gray matter is further divided by a transverse gray commissure into a narrow, elongated posterior horn and broad anterior horn. Okay. So this is a spinal cord. Okay. This is measurements: length, average diameter, weight, extension. Okay. Upper end, lower end, everything is in this clear will be there. Okay. The drawing of the spinal cord is a very important. Same thing you have tried. I have given different structures, different positions, different coloring of the spinal cords I have shown ma. According to your wish you can draw it, but don't forget to draw this one when you're asking the examination, the anatomy partition. Okay, enlargements: cervical, lumbar, cauda equina. Phylum terminate. L1 lower end of spinal cord. The nerve roots of 5 lumbar, 5 sacral and coccygeal nerves take a vertical course to form a bunch of nerve fibers around the phylum terminal. It resembles quada, tail, equina, horse. Quada means tail, equina means horse. The spinal cord is elongated almost a cylindrical part of the CNS, central nervous system, which is a suspension vertebral column surrounded by the meninges and cerebrospinal fluid. The second, the spinal cord is continuous above it. 45 centimeters in male, 43 centimeters in females. Little finger. The thickness of the, how much thickness about the little finger. Okay, so till now I have shown the content, little brief description about this structure, this spinal cord. It's very important in the unit of the 10th in the nervous system. Okay, thank you all for watching my channel. If you like this video, please like it and share to your classmates. Make them to subscribe my channel. Thank you. Bye bye. See you next video. If I get the time, I will also I will provide at the end of this day one more video. I will also try to upload. That is nothing but the cranial nerves. Second day challenge, cranial nerves. Definitely I will try to done this I will try to upload the third topic of the second day. Thank you all. Bye bye. See you in next video.